Good afternoon, everyone. Thank you for joining today's webinar on expanding knowledge related to hepatitis B among nail salon workers in the United States. My name is Catherine Freeland, and I'm the Public Health Program Director at the Hepatitis B Foundation. And I'm pleased to present with my colleagues at the Hepatitis B Foundation and Hep B United today's webinar. I have the privilege of working and being a part of this exciting project that we'll be speaking with you today about. Before we get into the presentation, I'd like to review a few housekeeping items and let you know how you can participate in today's webinar. Please note that all attendees are in listen-only mode and will be muted throughout the webinar. There's a phone-in line, and the call-in numbers are listed within the slide. You may submit questions in writing during the presentation throughout the session and put them in the question box on your GoToWebinar control panel as pictured here. We will be reviewing them as they come in and hold a Q&A session at the end of the presentations. And finally, today's webinar is being recorded. You will receive an email with a link to view the recording of today's webinar after the session. Before we get into the presentation, I wanted to provide you with a bit of background on Hep B United in case you're not familiar with it. Hep B United is a national coalition established by the Hepatitis B Foundation and the Association of Asian and Pacific Community Health Organizations, or APCHO, to address hepatitis B. Hep B United is dedicated to reducing the health disparities associated with hepatitis B by increasing awareness, screening, vaccination, and linkage to care for high-risk communities. Hep B United Coalition is comprised of over 40 state and local and national partners across the U.S. You can see a map here as a visual representation of our partners. There's an estimated 2 million people in the United States that are chronically infected with hepatitis B. This month of May is Asian and Pacific American Heritage Month and Hepatitis Awareness Month. So we think that it's fitting to highlight this innovative program that we'll be speaking to you about today that addresses viral hepatitis and other environmental exposures within the Vietnamese nail salon community. Today we'll learn from an initiative out of Philadelphia, Pennsylvania that seeks to expand understanding of the role of hepatitis B within the nail salon. At this time, I'd like to introduce our presenters. Dr. Tran Hun, she is faculty with the Dornsife School of Public Health and Drexel University, as well as 3 colleagues from VietLead, a community-based organization in Philadelphia and Southern New Jersey. Nancy Nguyen, Tracy Nguyen, and Nha Vu will be presenting today on VietLead. At this time, I would like to turn it over to Dr. Tran Hun, who will be providing us with an overview and background of the project. Tran, I'll turn it over to you.
Thank you, Kathleen, for inviting me to present in this webinar. So before I go into the project, I will speak a little bit why I'm interested in this project and how it started. So as a Vietnamese American growing up in America, my mother and a lot of my families work in the nail salon industry. And so when I was studying my PhD at the University of Minnesota in occupational hygiene, I have already, I think before I studied occupational hygiene, I didn't know about the hazards in the workplace in general. And when I learned about it, and I was like, oh, wow, my parents or my family are working in nail salons, and I started to get curious about all the different hazards in nail salons, and that's when I started to gather articles and literature about the nail salon hazard and health effects in general. But at the time, I wasn't working on the nail salon study for my doctoral work because I was working on a different project. But when I started my faculty appointment at Drexel, now I have more flexibility and freedom to start projects in my interests. And so that's when I applied for the NIOSH Career Award, which allows me to buy out classes where I can study more about intervention development and working with communities. And then through that, I'm learning a lot, working with community organizations and developing interventions that are theory-based. It's still a learning process. And so now I'm presenting you some of our preliminary work. Actually, it's not preliminary, some of the first stages of the entire project, and where we'll be going from now. Next slide. So for the outline of the study, the outline of the talk, I will talk a little bit of the background study, which is the needs assessment that we did before we did the hepatitis B assessment on the knowledge and access to care in the NEO community. And so, and then VietLead will talk a little bit about their organization, their work, and how they have been helping us with the NEO Salon project. And then I will talk about the results of the qualitative study that we did collaboratively with the Hepatitis B Foundation and VietLead, and then our future work. Next slide. So in Philadelphia, we have about 14,000 registered nail technicians. Actually, in Pennsylvania, we have about 14,244 registered nail technicians, and you can actually get the exact number because I think all nail technician has to register with the PA Board of Cosmetology. And we found that at least 46% are Vietnamese, and we found that based on the names of the people that register. And then in Philadelphia, we have about 396 salons, nail salons, out of the 2,386 salons out of the whole state. So if you compare that to the national nail industry statistics, it's pretty close. According to the number estimated by the by Nail Magazine, we have about 390,000 nail technicians nationwide, and this number kind of vary depending on what sources that you use. And some people might think that this number is a little bit an overestimate. And some other sources use I think government statistics, and they have much lower number, but it's kind of hard to have the exact number because there may be people working who are not registered with the Board of Cosmetology or with any government sources. And we found that over half are Vietnamese, and there's also a large number of other Asian minorities that make up the workforce, and then we have Caucasian. So the majority are female, and the age range kind of vary among these groups. We have young people, and we also have older people in the workforce. And the highest level, the majority finished high school or have some sort of college or tech or associate degree in working in the industry. Next. So in the nail salons, we are concerned about a number of hazards. So the most common hazards that many of us are aware of are, of course, the chemicals that used in the nail products. And those tends to create some of the short-term health effects that have been documented. In the past 10 years, actually, research has been that there have been people studying this over the past 10 years. It's just that intervention studies that haven't been really caught up with the research that has been done. So some of the health effects associated with the chemical exposures are irritations of the respiratory systems, nose, throat, and like coughing, and then also dry skin and cracked skin if they don't use gloves to protect themselves from things like acetone. And there's also some evidence of cognitive symptoms. And so how do they know that there's some decline in cognitive symptoms? So in one of the studies, they use tests to evaluate how technicians response to some of these tests that evaluate in the domains of the attention, processing speed, and even a sense of smell. And they found that technicians, when you compare it to the control group, tend to have poorer performance in some of these cognitive tests. Yeah, and then musculoskeletal disorders. So these are pain in the muscles, musculous pain in the neck, shoulder, and this results from repetitive use of the hands and or sitting in awkward positions for a long period of time. And one study found that there no strong evidence of cancer access found in cosmetologists and manicurists, and the study was done in California. So I think the conclusion, she said that I think they need to have like a stronger studies to confirm what they found here. And so, because indoor air quality is a big concern, there have been a few studies that looked at indoor air quality in nail salons, and the general consensus is that the indoor air quality in most salons generally exceed typical like indoor, typical salon, typical carbon dioxide concentration, and then also there's also exposure to total volatile organic compounds. And if you see in the typical homes, we have only about 330 part per billion, but in salons it's way higher than that. And the concerns is that, for a lot of, if you analyze individual chemicals like toluene, the exposure level, the chemical exposure level typically is lower than, say, the occupational exposure limits. But we don't know what's the effect of being exposed to all these chemicals at low level for a long period of time. And so that aspect, we don't have evidence in the literature to indicate that there's could be potential long-term effects associated with chronic exposure to low level of chemicals in the salons. So, so next slide. So the overarching goal of this project is to develop an evidence-based health and safety multi-level intervention program for nail salons owners and workers. So the idea is for developing a multi-level, and I emphasize working with owners is because based on what we've learned from the owners and the workers that we talked to, a lot of the environmental conditions at the salons is really controlled by the owners. And so if we can train the workers, but we don't have buy-in from the owners, it will be really hard to make changes in the environment of the salon that would support more sustainable long-term changes in the salons. And so for this study, we really emphasize working with the owners and helping them make changes in the salon's environment, which we think in turns would help with the improving the health of the salon employees and the customers. So we have had, so this is the big study, I mean the big picture of what the study would look like. I think in the past 2 years, we did the green part with the needs assessment for the house, the needs assessment with the nail technicians and the owners. And I think last year, Kathleen came to me and sort of educated me about hepatitis B and how it disproportionately affect the Asian community. And I thought, oh wow, this could be a good addition to what we're already doing, since a lot of nail salon workers come from the Asian American communities. And so that's how we started with the hepatitis B project and wanted to include the hepatitis B component to the comprehensive health and safety training that we are going to implement. And so far we've recruited, so because with intervention studies, it's really, I think for researchers, we are used to the idea of us developing the interventions and have people tested. But when in my work or class with community engaged research, some of my mentors really encouraged me to invite the end user of the thing that we developed to be part of, and have them really be part of the training development process. And so and that's also in addition to the community organizations that we're working with. And so we did recruit. We were able to have 4 people from the nail community to serve as consultants on our projects. 2 of them from owners and 2 of them are the workers. And because they give us access to their time, and so we were able to talk a little more about their preferences and what they see, what they want. And that's kind of different from the focus group that we did. And so for the components of the, this is still really work in progress. We're thinking of developing like a self-assessment tool, which is like a checklist for the owners to do, and then informational resources. And a big component, for me, I think as a researcher, I think myself of developing the tools, but the real implementator of this really are the community organizations. And so the training of the community health consultants will be the key to this process, because I don't think Drexel or I should be in the positions of delivery of these training. So that would be a big component for us. And we hope to pre-test the intervention with 1 or 2 test salons before we test with the 12 salons, where we do baseline assessment for the indoor air monitoring and the surveys. So next slide, I'm going to talk very quickly about some of the findings that we found for the needs assessment. So this is a pilot study that we did a couple years ago when we interviewed people and did focus group. And so we found that we confirmed that most participants, nail technicians and owners, do experience some sort of adverse health symptoms related to respiratory health and even their musculoskeletal pain. And we also found that some of them have already implemented some protective practices For example, some salons also use not require or encourage employees to use gloves, surgical masks, and they also do housekeeping at the end of the day. And some people also try to manage their musculoskeletal pain by, trying to sit straight up, standing to walk between customer, or using pain reliever, or having some family members to cover their shift if they are in too much pain. But we found that some of these protective practices were not consistently implemented across salons that we found. So the next one, in the next slides, we wanted to understand what are some of the factors that would influence the adoption of safety practices. And so we found a few, and so the first one is the perceived health benefits and concerns. Some of the workers told us that they do care about their health, and so that's also one of the reasons that some of them are interested in receiving this kind of training, if it's available to them. And also that's also one of the reasons that they use protective equipment, even though it's not very convenient. In terms of the knowledge of the hazards of nail salons, so it's either chemical, ergonomic, and biological hazards. These kind of vary among the people that we talk to. Some of them, a lot of time when they first started, they didn't know, but through experience, they started to realize that some of the chemicals are bad for them. But we know that having the knowledge does not necessarily translate to actions, because some of the barriers that I would discuss later, and also mainly because, if they're a worker, they don't really have the control over how the salon is being managed, or what kind of policy being enforced at the salons. And so there's a lot of challenges that people talk about wearing protective equipment. So that's why some of them don't wear them for some of the processes, like, discomfort, slippery. It's kind of slowing down gloves, so gloves will slow them down. And, some salons also do not offer PPE, and some of them have to buy PPE for themselves. So next one, again, we found that the owner has a lot of saying in how the salon is being managed. So again, it kind of highlights to our original intention that we really need to work with the owners in order to make the changes more sustainable. Clients also have some influence on how the salon is being managed, and also external regulations. Owners are generally responsive to what's being required of them in order to run their salons legally. And so if a salon is in a mall, and the mall require that you have to have a certain ventilation requirement, so they will do it in order to be able to operate their salons. So next, so why are infection control practices and hepatitis B important at nail salons? From the department, the health department, and the consumers, they are very concerned about sanitation and infection control practices at nail salons, to prevent bloodborne pathogens and fungal infection. And so these stakeholders, they are not as worried about the chemical exposure nor the ergonomic hazards that I, as an occupational health professional, would be worried about. So in most healthcare settings, bloodborne pathogens risk is high, where bloodborne pathogens is high. So hepatitis B vaccination will typically be required for healthcare workers. In nail salon setting, the OSHA, the federal agency responsible for enforcing workplace safety, thinks the risk is low, and so they do not require hepatitis B vaccination, and they only encourage them. And so in most salons, often overlook this guidance. Next, please. So if you look at the transmission of hepatitis B, so you have unsafe injection and medical procedures. And so all of these routes, I think the first route of using multiple tools would be one of the routes for people working at nail salons. And so next, please. And then the reason why I'm really interested in working with hepatitis B, after the organization kind of educated me that how Asian Americans are disproportionately affected by this infection. It's actually not so much from transmission at the workplace, but more because they already got the infection from their home country. But because we are doing this intervention already, it would be an avenue for us to help the community if in fact they do get the vaccination that they need, or get the help if they do in fact already have the infection. Then we would be able to help them, connect them with the resources they need to manage the infection. So like again, I said, exposure, I did some research on risk of hepatitis B or C transmission at nail salons, and there hasn't been a lot of research or evidence, but I do know that accidental cuts do occur at nail salons, so there is a risk there. And because nail tools are used multiple times, so if the tools are not disinfected properly, we do have a transmission risk between customer or even between the workers to the customer and vice versa. So next, so that leads us to the qualitative project that we did with the Hepatitis B Foundation and VietLead to learn about some of the screening practices and knowledge of hepatitis B among the nail community. And I'm going to turn over to VietLead at this point so that VietLead can tell us a little bit more about their organization and the work that they've done with the community here in Philadelphia.
Thank you. Can you hear me?
Yes.
Great. So hi everybody, my name is Nancy Nguyen. I'm the Executive Director of VietLead. Thank you, Catherine, Hepatitis B Foundation, and Tran with Drexel for this opportunity to talk a little bit about our work. I'm going to talk briefly about our organization, and then I'm going to hand it off to my colleagues, Tracy and Nha, to talk a little bit more specifically about the health program and also the nail salon project. So again, VietLead is a nonprofit grassroots organization. We operate or we serve the Vietnamese and broader Southeast Asian community in Philadelphia, and some folks in the collar counties, as well as South Jersey, primarily Camden County, Burlington, Gloucester, and Atlantic City. And so our organization has, we have a way of sort of thinking about our work. We have, so you see on this image, there are 3 practices that we really try to center our work around. That is heal, resist, and grow. And so in all of the components of our work, we're thinking about how it dovetails with healing practices, practices of resistance, and organizing and growing, which is both a kind of tongue-in-cheek because we do have an urban farm, but also like how do we grow different alternative community solutions that, like it says here, promote the ecological well-being of our communities and of the broader planet, actually. And so we have 6 programs. Community defense, which works specifically with folks who face ICE detention and deportation. Health and healing, which later Tracy will talk about. The Our Roots Youth Program, which does supports with leadership development with high school youth. and in various chapters around the city. Our Resilient Roots Farm, which I talked about before, is our urban ag work. We have a farm in East Camden. Our Cooperative Project, in which we look at cooperative business practices, and our Civic Empowerment program, which supports our community in electoral organizing, getting out the vote, and helping connect our community members with very important sort of civic duties, right? And so basically, our organization, we were founded. I am a co-founder, as is Tracy and Nga, founded in 2015 with 5 of us who'd been working in the Vietnamese community for collectively probably 20 years or so. And so I guess all of this is to say that though, you know, we may sound like a new organization, a lot of the staff members have come in with many years of experience, and with that, relationships into the community in both Philadelphia and South Jersey, which, as you can see, will be sort of central to our ability to be successful in this partnership. So I'm going to hand it over to Tracy. Go ahead, Tracy. And next slide.
Okay, thanks, Nancy. Hello everyone. My name is Tracy Green. I'm a health project director at VietLead in Camden, New Jersey. I have been working in Vietnamese community for more than a decade with the health and healing program. We provide direct services and individual client section to increase access to healthcare. We assist people to apply for New Jersey Family Care, Medicaid, ABD, and Medicare, Obamacare, New Jersey SNAP, LIHEALth. And beside that, we conduct various health workshops focusing on breast health, cervical, colon cancer, and nutrition to deliver resources and increase the awareness of cancer. So members feel more like empowered to take control of their health. We serve about 300 women every year through running monthly clinic with Cooper Hospital and South Jersey Radiology to assist women who are low income, uninsured, or undocumented immigrants, and health insurance does not cover for this service in annual mammogram, colon, and pap smear checkups. So we also provide interpretation, provide translation, transportation, and patient navigation for mammogram, colon, and pap smear. Also, we focus on elders too. So the services to seniors provide activities and services that prevent isolation, maintain or improve the physical, psychological, and social well-being of older individuals by providing appropriate senior services. Also, we have them participate in our garden days at our Resilient Roots Garden in Camden, where they can participate in teaching youth and do the garden works. So for this nail salon project, Dr. Tran from Drexel University reached out to VietLead, and we think like this project was very helpful for our community. So we started to collaborate. So let me introduce Nga Vu, who is the main person that implement this project. She will tell us a little bit how to recruit and the relationship with the nail salon. So Nga.
Thank you, Tracy. Hi, everyone. My name is Nigel. I'm the VietLead Health Coordinator based in the PA and New Jersey. And today I can say a little bit about how I recruit the person in this Project. First, I want to say, like Casey and Nancy say, we have been working very closely with the Vietnamese community for many years, and we are like familiar with the community about know many people with this. And since 2015, in the PA and New Jersey, we have the provide direct services such as like Obamacare, Medicaid in the state, social benefits for adult, elderly, and as well other healthcare services. On the health screening for the program, or Phil we with the couple hospital in the New Jersey, and also we work with the Temple University Asian Health Workshop in the PA too. Vietnamese-owned salon worker across of a majority of the people in the health screening program. And I think this is very excellent for us, for the opportunity for us to build a trust for community and make us very well-known organization in the PA and New Jersey. And when VietLead get this program with the Hepatitis B Foundation with Catherine and University Drexel with the Trend, we are planning and call the pupil, the recruit from the housing contact list, and most of pupil agree to attend the workshop because of the positive the relationship and all the trust we do so many years with the community. And the second thing I want to say a little bit this because I'm is the worker in the nail technician in the nail salon, and I have hand experience in this job, and because in my experience I have a in-depth understanding of the view and the view for the thing who the work in the nail job able to effectively and situation to work this work, and I use my previous the relationship with the Bob nail salon owner and worker to the recruit the participant in my workshop. And the third thing I want to say in here, very important too, when we are carrying the program, we will do with other discrimination and the truth. The participant in the program will benefit greatly by combining the knowledge they have to learn from the hepatitis B to automatically help them in the career in the future. And we can send the truth to the people we recruit. Yeah, that's all the thing when I do this program and I recruit the person. And thank you so much for Jen and Chi Chung give the time for speaking that. And now I can hand over for the Catherine.
Thank you, Nia. I think Tran will present the project results and findings and next steps.
Yes, so for the last 5 minutes, I will talk about the results of the hepatitis B study that we did together. So as you heard from VietLead staff, we could not have done this project without their help. because for people who work with minority community, it's really hard to recruit people unless you have existing relationship, and also you have trust with the community. And because VietLead already have that existing relationship and trust, they were able to really help us with recruitment, and also just really be the bridge to the research team and the community. And so now I'm going to briefly talk about the results of our study. So through analysis of the transcripts I think we recruited 19 people to participate in the focus group and interviews. We found these themes related to hepatitis B knowledge and screening practices. So I will go over each of these themes in the next few slides. In terms of knowledge, there's a general overall lack of knowledge related to hepatitis B. There's still a lot of misconceptions about its transmission, symptoms, and prevention. So for example, some participants mentioned that hepatitis B can be spread through food or water intake. One also suggested that transmission can occur through mosquito or even spread genetically. And so these are really important for us to know, so that when we create our targeted education materials, we would be targeting some of these misconceptions that we found in the studies. So next, we also found a lot of barriers related to screening practices and testing and screening for hepatitis B. Some of them include lack of health insurance. Long work hours is also another thing that people also indicated. So nail salon workers or employees and even owners work very long hours. They work, some salons open 6 to 7 days a week, and so if they have to take time to make an appointment to go for testing, that means hours that they would not have to earn a living, and so they consider that like a very huge inconvenience. But if they would only go, and a lot of them will only go to the doctor if they feel really, really sick, but not for preventive care. There continues stigma and discrimination with people who have hepatitis B, and so some people are afraid of interacting with people that have hepatitis B, and they would not drink or eat together. But we know that hepatitis B doesn't spread through eating and sharing meals, and so that's some of the things that we really need to target in our training. And for even those with hepatitis B, they are also afraid to socialize with people, because they are afraid that by sharing meals together, that they might spread the virus to their colleagues. So next, in terms of screening and testing, here, so my slides, okay. People did not know that they should be tested, and when they go to the doctor, usually the doctor would tell them to do a whole bunch of tests, but people they don't know, and they typically assume that those tests include hepatitis B testing in their annual visit. And so there's still a lot of confusion about what kind of test that they get, or what exactly the kind of test that the doctors do when they go to the doctor visits. And then we also found that seems to be inconsistent information that provided to the people who go through the NEO training to get their licenses. Some people say that they didn't get a whole lot about hepatitis B information when they went through the training, or some said just a little bit. And another thing in the nail salon industries is there are also people who also work without licenses, or if they are just working toward the licenses, they still work at the salons but not necessarily receive the needed training in order to work. And so there needs to be a way for us to reach those kind of workers as well, those who are not formally trained at cosmetology schools. And our research participants also gave us a lot of suggestions in terms of how we could reach the nail community, and these include posting in common areas like the supermarkets, Vietnamese nail salons, Vietnamese newspaper. They also talked about if you really want to go to a church or the temple, it's really important you get that you need to ask permissions from the leader of the church or the temple. And then we also talk about using social media and YouTube, social media platforms to reach to people too. So in terms of the next steps, we have had some hiccups along the way in terms of grant funding, but we're hoping that the current grant will go through so that we will be able to implement the pilot studies in Philadelphia and in the summer or whenever this epidemic is slowing down, and then we are able to get back to work. But currently, because of the COVID-19, and some states are already starting to open for business, so there's a need for us to prepare the nail salon industry for safely returning to work. And so right now we're working toward, we're developing guidelines and also resources. So we're working on a website to offer COVID-19 resources and how to safely return to work for the nail industry. And of course, in addition to our original training topic like chemical hazards, biological and physical and ergonomics, we will be incorporating hepatitis B information and to dedicate more time to talk about hepatitis B and offer free testing to our research participants. And we want to document that if through the Healthy Nail Salon training program, how many workers who actually get tested or vaccinated through that mechanism, and also the extent of which that they would also influence people in their network to also, like their family and friends, to get tested and vaccinated for hepatitis B. So I think that would be a very interesting data collection process for us to see the impact of the Healthy Nail Salons on hepatitis B testing. And also, if things go well, we would like to pilot this program in different states. Right now, I'm eyeing in Minnesota because I have existing relationship with people in Minnesota that will be able to carry out or implement the pilot study there. So I want to acknowledge the funders, CDC, NIOSH, also Drexel. We also get some pilot funding from Drexel. And I will open up for questions from the audience.
Great. Thank you so much, Tran, and my colleagues at VietLead for this excellent and informative presentation. You guys are wonderful, and I'm so lucky that I get to work with you all. At this time, I'd like to open it up to the audience for question and answer. If you have questions for any of the panelists, please do not hesitate to type in your questions in the question box or the chat box, and we'll be sure to get to those as they roll in. We do have a couple of questions and I think this could be for anyone or all of you guys to help answer. The first question is, for an organization who is interested in working in nail salons to address hepatitis B or other environmental exposures that nail technicians or workers might be exposed to, do you have any advice for how to get buy-in and how to get them interested in or are they interested in working and addressing these issues?
I'm gonna have Nga from VietLead talk first and see how she's, convinced people to join our study, and then I can also chime in my thoughts. Nga?
Yes.
Nga or Tracy, because you both working closely with the community.
I can just repeat the question so you guys can hear it again. Do you have any suggestions for organizations across the country who might be interested in working in and with nail salons and how they might be able to start that?
Yeah, I can give some idea for somebody want to start with the nails salon, because the nail salon person, when they work with the community, they really scared because they don't understand much the English. That's why all the information we give out, they very so be careful. But if we want to work with the person work in the nail salon, maybe we can have somebody work in the community and can work with them for some the services they need it, like maybe for the accounting, for the tax return any year. If they want to have that, we can start what this first. Some the program they have the issue, and we can help them for services first. And after that, we work long term, and we can build a job. And after that, we can contract back and do more the program after that. This is my experience.
Yeah, so it's establishing in a relationship first, helping them with some of their needs that they might have, so you can build that trust and establish that relationship. Does that sound right?
Yes.
Great. Tran, do you have anything, or Tracy, anything you guys want to add?
So I agree with, and I think that's what brilliant about the work is, so they have already done a lot of work for the community on other issues, and so the nail community is really an integral part of the Vietnamese community. So when they do other stuff, I think helping access to healthcare or health insurance. Even though it's not part of the nail salon, it's already, but it's still a need that nail salon workers and owners needed the help from VietLead, and so that helps make it easier for them to kind of ask, we're doing this project, would you be interested in, versus somebody like me who did not have an existing relationship with the community coming and ask them. And so I think it would be very difficult to do it that way. So that's why it's very critical. I think VietLead is critical to the success of this project.
Thank you guys so much. One of the things that came up from the findings of this study was stigma. Do you have any thoughts on how you might address stigma in your future trainings that you'll be doing in the community? I would say that I don't have much experience
with addressing stigma related to hepatitis B. And I think Catherine and Sherry probably have more experience because they worked with hepatitis B issues for a long time. But for me, one of the most important things is to really address the misconceptions and misinformation. And then I think because of that, that will lead to the discrimination and stigma, because really people are just afraid that they will get infected. But if we address the misconception, I think it would help. But I will also let Catherine chime in on that one.
Thank you, Chen. I think that's a perfect answer, and thinking about expanding knowledge and addressing knowledge, building people up to have more knowledge about the condition will certainly help. So I totally agree with what you said. One thing that I wanted to ask as well, you know, with everything going on and the current environment with COVID-19, how is this impacting the community, and how is this going to impact potentially the future of this training module that you guys are proposing?
Yeah, that's actually on my mind a lot. So there's a good and bad things. So the good thing about COVID-19 is that it really raises the perceived susceptibility and severity of infectious diseases in nail salons. So which means that it will help, it really help people to take infection control practices and measure more seriously, like actually wearing gloves all the time or doing disinfectant really carefully after each client and all of that. I mean, even before COVID-19, those would be the recommendations that we have. I'm sorry, okay. My baby is here. So those are the recommendations that we would have for typical infectious disease, non-COVID-19. And so with this, I think it really helps it will really help the people take the training more, the recommendation more seriously. But at the same time, I think it will really screw up results in terms of the baseline data. And so we will probably, I think we will probably need to make note of that the baseline data is just unusual because of COVID-19.
Great. And Nancy, Tracy, Nya, do you guys have any thoughts on the impact that it's having on the nail salon community from what you're seeing?
I can start and then maybe Nya can chime in. And when you say impact, you mean like COVID-19 overall impact, right?
Yeah, in the nail salon community, the Vietnamese community, and how you guys think, or how you're working to address.
I mean, well, I think the most immediate thing obviously is like folks had to shut down all of their stores, which means that everybody who's a worker is on unemployment, owners are on unemployment. Like they have suffered probably 6 to 8 weeks of complete loss of income, right? And so there's like a severe economic impact here. And I think there's a lot of questions about how to return to work and when. There's a lot of confusion. I don't know where all the listeners are, but you know, we work in Philadelphia County and in Pennsylvania. There's this tiered system of counties returning to work at a certain capacity, but in New Jersey, they expect for the entire state to open at once. It's all very confusing, and obviously nothing is translated. And so I think that what our role is as an organization is to try to keep abreast of all of the news and changes coming down from governments about when people can open, and also to work with our partners, such, you know, as Tran said, and the Nail Salon Collaborative nationwide, to support nail salon owners and workers in thinking through what changes they need to adopt sort of indefinitely because of this pandemic, which of course in light of hepatitis B has those good points. But I think that yeah, we're working with workers in this one industry, and I think that there is going to be a lot of need for communication support, information sharing, and sort of like being that bridge between these small business owners and the local governments to help them open up in ways that are safe for them as workers, obviously, and then also for the broader community. Yeah, do you want to add anything?
Yeah, like the Nancy say is and maybe in the future VietLead maybe have the web liner for the channel add a new and anything for the nail salon or the business, the small business can when they open the business, how the staff they need to do and protect for themselves and protect for the worker, because kind like social distance right now, but for this job in the nail salon or the hair salon or something, they cannot distance when this job. That's why the worker have the impact more than other job, you know.
Definitely. Well, thank you. I know these are things that we need to continue to think about as we roll out these programs for those that are most vulnerable to these conditions that we're speaking of. So I wanted to first thank our excellent panelists today. You guys are wonderful and did an excellent job sharing your work and this specific project, and continue to do the excellent work you're doing. And we look forward to continuing this partnership with you as well. If we were not able to get to your question, we'll be sure to address those. We are at the top of the hour. If you have questions, you can also reach out to us at the email addresses here. If you want more information, you can also check out our websites linked here. We'll be sending out a follow-up email with an evaluation. Please complete that for us. It helps us do a good job and evaluate the webinar today. And thank you all again. And with that, I'd like to conclude our webinar session.